Hello everyone. In today's session, we'll be revising all bones of the lower limb. So here we can see bones of the lower limb of both the side. This is the bones of the right side. These are the bones of the left side. So before beginning, let's enumerate all the bones of the lower limb and identify them. Which bone is this? This one is the hip bone. Okay, this one is femur. And then there's a small bone here in front of the knee joint. Which one is this? This is the patella. Okay, this is the tibia. This is fibula, and these bones are the articulated foot. Okay, similarly I've kept on the of the left side as well, okay, so that it becomes easy for side determination. Okay, so any bone, when you are learning, first thing that you have to do is determine the side of that bone. Okay, so we'll start with the hip bone. Okay, so this is the hip bone which I'm picking it up. So this hip bone is of which side? This is of right side. Okay, so why it is of right side? For that, we can hold the bone in anatomical position like this. We have to hold it in the right hand in such a way that the hand goes in this notch here. This notch is called as the greater sciatic notch. Okay, you have to put the hand in the greater sciatic notch and hold it like this. Okay, so there are three side determination points that you should cover. This upper expanded part is called as the ilium. This should be on the superior aspect. Okay, then this part is referred to as the acetabulum. Acetabulum should be facing laterally. Okay, and this greater sciatic notch itself is on the posterior aspect. Okay, so this is how we can determine the side of the hip bone. So this is hip bone of the right side. Let us see how the hip bone of left side looks like when we have to hold it in the left hand like this. Okay, again the side determination points will remain the same. Ilium on the superior aspect, the acetabulum on the lateral aspect, and the greater sciatic notch on the posterior aspect. Okay, so this is the hip bone of left side. This is the hip bone of the right side. Okay, and now I'll be describing in details in the right sided hip bone. Okay, so the three different parts of the hip bone are ilium, and this one is the ischium, this one is the pubis. Okay, and in different parts of the ilium, if we see, anterior part is referred to as the anterior border, which has got some projections. This projection is the anterior superior iliac spine. This is the anterior inferior iliac spine. Then posteriorly, similarly, there is a posterior border with posterior superior iliac spine, posterior inferior iliac spine. As we come down, there is a notch here called as the greater sciatic notch. Okay, and this surface here is the iliac fossa and the sacropelvic surface. Okay, there are two parts here. Anterior part is the iliac fossa, posteriorly is the sacropelvic surface, because the sacrum articulates here, and this part, this surface is referred to as the gluteal surface. Okay, where the gluteal muscles would be attached, and this upper part is referred to as the iliac crest. Okay, which has got an anterior 2/3 segment and a posterior 1/3 segment. Okay, so the other different parts of the ilium. Then if we see the ischium, there is the ischial tuberosity, and there is a body of the ischium. There is a projection called as ischial spine. Okay, so the other major parts of the ischium. When we see the pubis, there is a body of the pubis, there is a pubic crest, pubic tubercle, a superior ramus and inferior ramus. Okay, and this opening that we can see here, this is called as the obturator foramen. Okay, this opening is obturator foramen. Okay, and this cavity here, this is the acetabulum. Okay, acetabulum is actually formed by all the three parts of the hip bone. Okay, okay, there is an acetabular fossa and the articular surface for the head of the femur. Okay, so like this, we should know different parts of the hip bone. And then on this medial border, upper part, there is a line called as the arcuate line, and when we trace down, there is an elevation called as iliopubic eminence. Okay, because it is between the ilium and the pubis, the elevation is called as iliopubic eminence. Okay, now let us cover some attachments of the hip bone. So attachments of the ilium, if we see, anterior superior iliac spine, very frequently asked in exam. What is attached here? It is the sartorius muscle along with one ligament, that is the inguinal ligament. Okay, so one muscle and one ligament getting attached on the anterior superior iliac spine, and anterior inferior iliac spine, one muscle is straight head of rectus femoris, and there is one more ligament here called as the iliofemoral ligament. Okay, one of the strongest ligament of the body, iliofemoral ligament. Okay, so one muscle and one ligament on the anterior inferior iliac spine as well. Which muscle was that? That is the straight head of rectus femoris, and the ligament is iliofemoral ligament. Then this iliac crest has got a lot of attachments. Okay, I told you there is an anterior 2/3 segment. So from outside to inside, there are three muscles called as the external oblique, internal oblique, transversus abdominis. Okay, and on the iliac crest outer lip, when we see 5 centimeters behind the anterior superior iliac spine, there is an elevation called as tubercle of the iliac crest. Okay, and in front of this tubercle there is a small muscle attached here called as the tensor fascia lata muscle. Okay, and as we come little bit behind, there is a muscle here called as latissimus dorsi and quadratus lumborum. Okay, and on the posterior 1/3 segment, outer sloping surface, there is gluteus maximus, and on inner surface there is erector spinae muscle. Okay, and on this iliac fossa there is iliacus muscle. Okay, iliacus muscle arises from here, and on this gluteal surface there are 3 gluteal muscles. Okay, so on the posterior aspect is gluteus maximus, then there is gluteus medius, then there is gluteus minimus, and coming more down towards this acetabulum, there is a muscle here called as the reflected head of the rectus femoris. Okay, straight head was arising from anterior inferior iliac spine, reflected head is arising from here. Okay, and there are some lines which demarcate the origins. Okay, so there is a posterior gluteal line, anterior gluteal line, inferior gluteal line. All these lines, they arise from this greater sciatic notch. Okay, and then they divide the attachments of these muscles. Okay, I'll repeat again. Here is gluteus maximus, then gluteus medius, gluteus minimus, and reflected head of the rectus femoris. Okay, as we see this part, this is the ischial tuberosity. Okay, there are muscles of the posterior compartment of the thigh which are called as hamstring muscles, which are attached here. Okay, so this ischial tuberosity has got parts, different parts. Okay, there is an upper quadrangular part and lower triangular part. In the upper quadrangular part, superolateral surface, there are 2 muscles. On the superolateral part, there is one muscle called as semimembranosus, and on the inferomedial part, there is semitendinosus and the long head of biceps femoris. Okay, then on the lateral aspect of this ischium, there is a muscle called as the quadratus femoris. Okay, from here it goes to the femur. Then this pubis has got muscle attachments of the adductor compartment of the thigh. Okay, the adductor longus, adductor brevis, adductor magnus, gracilis, pectineus, they all are arising from this pubis. Okay, from the body of the pubis, as well as there is a ramus called as the ischiopubic ramus. From there they are arising. Okay, so in general, if you want to remember pubis bone attachments, you can remember the muscles of the adductor compartment of the thigh. Ischium, you can remember muscles of the posterior compartment of the thigh. Those are the hamstrings. Okay, so like this you can remember the muscle attachments of the hip bone as well. Then joints formed by the hip bone. On the lateral aspect, this is the region for the articulation with the head of the femur. This is a hip joint, ball and socket variety of synovial joint. Then the 2 hip bones articulate in the midline. 2 hip bones articulate in the midline, that is referred to as pubic symphysis. It is a secondary cartilaginous joint. Okay, then the hip bone articulates with the sacrum. Okay, here in this part in the middle, the gap is filled by the sacrum. So sacroiliac joint, that is a plain variety of synovial joint. Then some applied anatomy related to hip bone. The highest point of the iliac crest is considered as the bony landmark for lumbar puncture. Okay, because it corresponds with L3 and L4 vertebrae. Okay, and as the spinal cord ends at lower border of L1, below that we can do lumbar puncture for drainage of the cerebrospinal fluid. And type of the bone I missed in the initial part. Hip bone, it is of which type? If asked, it is an irregular type of bone. Then there is an applied anatomy related with this ischial tuberosity called as Weaver's bottom. That's inflammation of the ischial bursa which is present here. Occupations involving prolonged sitting, they may have Weaver's bottom. Okay, so this was about the hip bone. Now we'll move on to the next bone. As we can see is the femur. Okay, so this is the femur of the right side, femur of the left side. So for side determination, you have to hold the femur of the right side on the right hand. So what are the side determination points? The head of the femur is superior. The head of the femur is facing medially. And when we see the posterior aspect, in this lower end of the femur, there is a fossa called as intercondylar fossa. That should be on the posterior aspect. Okay, that is how you can determine the side of the femur. Okay, so this femur is of right side. Suppose I try to hold it as if it's of the left side. See what point is going wrong. The intercondylar fossa is coming on the anterior aspect. Okay, so this should not happen. Okay, so that's why this femur is of the right side. Okay, and type of bone, if we say, it is a typical long bone having two ends, upper end, lower end, and a shaft. Okay, then different parts, let us describe. Okay, so upper end has got the head of the femur, then there is the neck of the femur, then there is the greater trochanter. Okay, this large part is referred to as greater trochanter, and this part is referred to as the lesser trochanter of the femur. Okay, and there is a line between the greater and the lesser trochanter. On the anterior aspect is called as intertrochanteric line, posterior aspect it is called as intertrochanteric crest. Okay, and inside the greater trochanter there is a fossa called as trochanteric fossa, and on this intertrochanteric crest there is one elevation seen that is called as quadrate tubercle. Okay, quadrate tubercle. So these are the various parts seen in the upper end of the femur. Then as we see the shaft of the femur, it has got three surfaces and three borders. Okay, out of which one border is very prominent. That border is called as linea aspera. Okay, the posterior border of the femur is referred to as linea aspera, and this medial border, lateral border, they are like rounded. They are not very well defined. And linea aspera, when we trace up, it splits into two parts, and when we trace down, again it splits into two parts. Okay, so linea aspera seen very clearly in the middle part, and in the upper part and lower part it diverges. And as we come in the lower end of the femur, lower end has got two condyles. Okay, this is the medial condyle of femur, this is the lateral condyle of femur. In between the two condyles there is a fossa called as intercondylar fossa. Okay, and the most projecting part of the medial condyle, this part would be referred to as medial epicondyle. Okay, similarly most projecting part of the lateral condyle is called as lateral epicondyle. This is the adductor tubercle seen on the medial aspect. And lateral condyle, we can see one groove here. Okay, there is a groove for tendon of one muscle that I'll tell you later on. Okay, so all these are the basic parts which are seen in the femur. Okay, so whenever you're describing, you have to describe in certain different parts. Okay, describe the upper end, describe the shaft, describe the lower end. Now similarly, attachments also we'll see region wise. So which muscles would be attached in the upper end of the femur? Okay, very frequently this bony projection is asked in exam. Okay, this projection we learnt, this was the lesser trochanter. What is attached on the lesser trochanter? Yes, it is the psoas major and the iliacus muscle. Okay, together they are referred to as iliopsoas. They are attached on this lesser trochanter, and on this greater trochanter tip, this upper part is referred to as tip of greater trochanter. There is a muscle called as piriformis muscle. Okay, piriformis muscle attached on the tip of greater trochanter. Okay, the ridge which is present on the greater trochanter for gluteus medius and gluteus minimus. Okay, and on this intertrochanteric crest, this quadrate tubercle gives attachment to the muscle quadratus femoris, and trochanteric fossa gives attachment to the muscle obturator externus. Okay, and just above the trochanteric fossa there is an area for obturator internus with two gamellae. Okay, in the upper end you have to remember the attachments of this trochanters and the attachments on the intertrochanteric crest, and this intertrochanteric line also has got attachments. In the upper part there is vastus lateralis, in the lower part there is vastus medialis. Then coming to the shaft of the femur, anteriorly there is a huge muscle attachment of vastus intermedius as well as two small slips of articularis genuis here. Okay, and as we see on the posterior aspect there are a lot of muscles on this linea aspera. Okay, and linea aspera, I told you, it splits into two parts. In the upper part, the lateral split has got rough elevation that is called as gluteal tuberosity. Okay, and medial split, there's a line called as the spiral line. Okay, so there are two different muscles on it. The gluteal tuberosity gives attachment to gluteus maximus, but only 1/4 of the fibers of gluteus maximus. Okay, majority of fibers of gluteus maximus go on the iliotibial tract. 3/4 go on the iliotibial tract. 1/4 comes here on the gluteal tuberosity. And on the spiral line there is a muscle called as pectineus muscle. Okay, and on this linea aspera there are a lot of muscles like the vastus intermedius which is there, that also comes here on the lateral aspect. Then there is a vastus lateralis muscle. Then muscles of the adductor compartment, one muscle of posterior compartment, the biceps femoris muscle, short head, arises from this linea aspera. Then from the adductor compartment there is adductor longus, adductor brevis, adductor magnus. They are attached on this linea aspera. Okay, let's come and see the attachment of the lower end of the femur. On the medial aspect there is the attachment of medial head of gastrocnemius, and on the lateral aspect there is lateral head of gastrocnemius along with plantaris muscle. Then this intercondylar fossa. This intercondylar fossa has got attachments of the cruciate ligaments. Okay, the lateral condyle is for the anterior cruciate ligament, medial condyle is for the posterior cruciate ligaments. These ligaments, they come from the tibia. Okay, medial epicondyle, lateral epicondyle, they have attachments of the, medially it is referred to as tibial collateral ligament, laterally it is called as the fibular collateral ligament. Okay, and I told you one projection is here called as the adductor tubercle. In this adductor tubercle, there is the hamstring part of the adductor magnus which is attached here, and this lateral condyle behind, I told you there is a groove that is called as that this groove is for the tendon of the popliteus muscle. So like this muscle attachments we have to learn of the femur, and joints formed by the femur, the upper end of the femur, it articulates with the hip bone to form the hip joint, a ball and socket variety of synovial joint. Lower end it articulates with tibia to form the knee joint. Okay, it is a modified hinge variety of synovial joint. It is compound joint as well, it is complex joint as well. Okay, then some applied anatomy related to femur. There could be fracture of the neck of the femur, very common in old age. Okay, then there could be fracture of shaft of the femur that could lead to a complication called as fat embolism. Okay, the neck shaft angle of the femur, if it is decreased, it is called as coxa vera. If it is increased, it is called as coxa valga. So all these are the applied anatomy in femur. Okay, let's move on to the next bone now. So there are two small bones that we can see. So one is the patella of the left side, another is the patella of the right side. So how to determine side of the patella? So once you keep on the table, the patella is tilting on one side. Okay, this patella is tilting laterally on the left side. Okay, this patella is tilting laterally on the right side. Okay, it usually tilts on that particular side, but you should be able to identify the side even with the hand. Okay, how to identify when the patella is in hand? So again, you have to look for the side determination points. For superior inferior, you have to see the base of the patella is on the superior aspect. For anterior posterior, you can see the rough part of the patella is anterior, the smooth part of the patella is posterior. Okay, and the most important side determination point is identifying which part is medial and which part is lateral. For that, you have to see this on this smooth part, there is a vertical ridge. Okay, there is a vertical ridge, and the lateral area would be a large area, the medial area is a small area. Okay, so large area should go lateral. That is how we can identify this patella is of left side. Okay, similarly this patella is of the right side. Here is the vertical ridge and the large area is on this right lateral side. Okay, so that's why this patella is of the right side. Okay, in different parts of the patella, base of the patella, apex of the patella, the two surfaces, anterior surface and the posterior surface. Posterior surface has got this large articular part of the femur, as well as there is a part where the ligamentum patellae is attached. And muscle attachments of the patella, if we see, the muscles of the anterior compartment of the thigh, specifically the quadriceps femoris. Okay, so quadriceps femoris, which part gets attached here? Anterior part, there is rectus femoris, posterior part there is vastus intermedius. Okay, and then along the medial border there is attachment of vastus medialis. Along the lateral part there is vastus lateralis. Okay, but this attachment of vastus medialis is quite extensive as compared to that of vastus lateralis. Okay, because patella has a tendency for lateral dislocation, so that is the reason why the medial large attachment protects the lateral displacement of the patella. Okay, and patella is an example of a sesamoid bone. Okay, so sesamoid bone is one which develops in the tendon of a muscle. So this develops under the tendon of quadriceps femoris muscle. Okay, and there are some characteristics of sesamoid bone, like it lacks the periosteum, it lacks the Haversian system. So if there is any fracture of the patella, it becomes difficult for healing. Okay, because periosteum contains some osteoprogenitor cells which help in healing. So because this patella lacks periosteum, it doesn't heal well. Okay, so this was about the patella. Let's move on to the next bone now. So here we can see this bone is tibia of the right side, tibia of the left side. So how to determine side of the tibia? Right tibia, you have to hold it in right hand. Side determination points are the upper end of the tibia, the condyles of the tibia should be on the superior aspect. the medial malleolus. Medial malleolus should be on the medial aspect. Okay, it's the name of this bony projection itself is medial malleolus, so you have to make sure that it lies on the medial aspect. And for anterior and posterior, you can look at this tibial tuberosity. Okay, tibial tuberosity should be anterior. Okay, so that is how you can identify the side of the tibia. This tibia is of right side. Tibia is also an example of a typical long bone, upper end, lower end, and a shaft. Okay, so the description of the upper end, if we see, there are two condyles. Okay, so this one is the medial condyle, this one is the lateral condyle. In between them, there is an area called as intercondylar area. Okay, and anteriorly we have seen this tibial tuberosity. Okay, then medial condyle on the posterior aspect has a groove. Okay, there is a groove for a muscle. Name of the muscle I'll tell later on, but there is a groove which is present posterior to the medial condyle. And lateral condyle on the anterolateral aspect has got one facet. This facet is for one ligamentous structure. You can think about it, what is attached here. I'll cover it in the attachments. Okay, and coming to the shaft of the tibia, it has got three borders. There is an anterior border, there is a medial border, there is a lateral border. Okay, and there are three surfaces: medial surface, lateral surface, and the posterior surface. Okay, so characteristically, three borders, three surfaces are clearly seen, out of which this medial surface is subcutaneous. Okay, we can feel it throughout, just beneath the skin. Okay, medial surface is subcutaneous with this subcutaneous border. Anterior border is also subcutaneous, and posterior surface has got one important opening which is seen. That opening is of nutrient foramen. Okay, so nutrient foramen of tibia is largest amongst any other bone, if you see. Okay, and on the posterior surface there is one oblique line which is seen here. This line is called as the soleal line. Okay, when we see the lower end of the tibia, this projection is called as the medial malleolus, and this is the articular surface for the talus. Okay, articular surface for the talus, inferior articular surface. So these are the different parts of the tibia. Now coming to muscle attachments in the tibia. In the upper end of the tibia, this tibial tuberosity gives attachment to the ligamentum patellae, which itself is coming from the quadriceps femoris. Okay, so quadriceps femoris first goes on the patella, and from there is ligamentum patellae, which comes here on the tibial tuberosity. Okay, then I told you medial surface is subcutaneous, but on the upper medial aspect of tibia there are three muscles which are attached. Which are those three muscles? There is sartorius, gracilis, and semitendinosus. Okay, sartorius is a muscle in the anterior compartment of the thigh. Gracilis is a muscle in medial compartment of the thigh. Semitendinosus is a muscle in posterior compartment of the thigh. Okay, from anterior to posterior, they are attached on the upper medial aspect of the tibia. And these three muscles together are also referred to as guy ropes. Okay, because they arise from three different compartments, and they also arise from three different parts of the hip bone and coming and converging towards the tibia. Okay, so like a tent they support. Okay, so these are referred to as guy ropes. Then on the posterior aspect of the tibia, behind the medial condyle, I told you one muscle is there. Which muscle is it? Yes, that's the semimembranosus muscle attached here, area behind the medial condyle. And there is a facet which is seen here. This facet is also called as Gerdy's tubercle. This gives attachment to the iliotibial tract. Okay, iliotibial tract. It's a structure which is seen in the thigh. On the lateral aspect, the deep fascia thickens to form the iliotibial tract. So here is the distal attachment of iliotibial tract. And this intercondylar area of tibia has got a lot of muscle, has got a lot of ligamentous attachments from anterior to posterior. It can be remembered by a mnemonic: Medical College Lucknow and Lucknow Medical College. Okay, so MCL. These three structures are in front of this intercondylar eminence. Okay, and the intercondylar area has got this projection called as intercondylar eminence anterior to it. M stands for the medial meniscus. Okay, so there is an anterior end of the medial meniscus. C stands for the cruciate ligament. Okay, so the anterior cruciate ligament is attached here. L stands for the lateral meniscus. Okay, so there is the anterior end of the lateral meniscus here. Then again posteriorly there is Lucknow Medical College. L stands for the lateral meniscus, the posterior end of the lateral meniscus. M stands for the medial meniscus. Okay. Then C stands for the cruciate ligament, the posterior cruciate ligament. Okay. So there are a lot of structures. It's better to remember the mnemonic and then name the structures in that particular order. Okay. Then coming to muscle attachments in the shaft of the tibia. This lateral surface of the tibia gives attachment to the tibialis anterior muscle. Posterior surface of the tibia, the soleal line, there is a muscle called as soleus, and below the soleal line there are two muscles here. One muscle is tibialis posterior, which is on the lateral aspect, and another muscle is flexor digitorum longus. Okay, so two muscles on the posterior aspect. So how do we remember this? How laterally is tibialis posterior? Because tibialis posterior is attached on tibia as well. It is attached on fibula as well. It is attached on the interosseous membrane as well. Okay, so that's why it has to be on the lateral aspect. And medial aspect, the muscle is flexor digitorum longus. If we see the digits are on the lateral aspect, but the muscle is arising from the medial bone. Okay, because later on in the course there will be crossing over. Okay, the digitorum longus muscle will cross over and go to the digits like this, and there is a muscle to the great toe called as flexor hallucis longus. That muscle arises from the fibula. Okay, and it will cross and it will go towards this great toe. Okay, so there's crossing over of the muscle occurs, so that's how we can remember this. Okay, so these muscles you need to remember in tibia. And joints formed by the tibia, if we see, upper end knee joint we have covered along with the femur, and lower end it forms the ankle joint, again a hinge variety of synovial joint, and tibia articulates with fibula. Okay, so there is a superior tibiofibular joint, middle tibiofibular joint, and the inferior tibiofibular joint. So superior tibiofibular joint articulation is here, that's a plain variety of synovial joint. Then middle tibiofibular joint is the interosseous membrane. Okay, that's a fibrous joint, syndesmosis. Inferior tibiofibular joint is also a fibrous joint called as syndesmosis type. Okay, so this was about the tibia. Now let us cover the fibula. Okay, so fibula is also of both the sides we have kept here. Okay, this fibula is of right side, this fibula is of left side. Okay, so how to identify which fibula is of right and which fibula is of left? Most important feature for fibula side determination is this fossa is called as malleolar fossa. Okay, you have to identify the malleolar fossa and you have to keep it posteriorly, and malleolar fossa also you have to keep it medially. Okay, so malleolar fossa is posterior, malleolar fossa is facing medially, and malleolar fossa is inferior also. Okay, so with the malleolar fossa itself, all three side determination points of fibula can be covered. Okay, so many a times the upper end of the fibula is broken and we may not be able to see specific features, but with the lower end itself we can determine the side of the fibula. Okay, so this fibula is of right side. This is again an example of a typical long bone having upper end, shaft, and a lower end. Okay, upper end of the fibula has got the head of the fibula as well as the styloid process. Then the shaft of the fibula has got different borders and surfaces. Okay, there is an anterior border, there is a medial border, there is a posterior border. So borders and surfaces of the fibula, you have to take the fibula and then you'll be able to learn them in a much better way. Okay, because there is a very small gap between the two borders. If you see the anterior border and the medial border, a very narrow area is seen here. That surface is the medial surface. Okay, and posterior surface of the fibula further is divided by a crest called as the medial crest of the fibula. Okay, so that's why it becomes difficult to understand these borders and surfaces. If you see the lower end of the fibula, there is a triangular articular surface and there is this malleolar fossa. Okay, articular surface, this will articulate with the talus. Then muscle attachments of fibula. Okay, fibula is a bone which is thin, but it has got a lot of muscle attachments as compared to that of tibia. Upper end of the fibula, this styloid process gives attachment to the biceps femoris muscle. Okay, And then in the shaft of the fibula, on the lateral surface, there are two muscles called as fibularis longus and fibularis brevis. Okay, also referred to as peroneus longus and brevis. Then there is a small surface called as medial surface. This surface gives attachment to three muscles of the anterior compartment of leg. Okay, so total there are four muscles. One muscle we have covered in the tibia, that was tibialis anterior. So remaining three muscles are attached on this small surface. So which are they? Extensor digitorum longus, extensor hallucis longus, and fibularis tertius. They all three muscles are attached on this surface. And on the posterior surface of the fibula, so I told you one muscle that goes to the great toe, that is the flexor longus, as well as the tibialis posterior, that is attached on this posterior surface. And posterior surface upper part also gives attachment to the soleus muscle. Okay, so in this way we can remember the muscle attachments of fibula. And fibula is a bone which violates the law of ossification. Okay, so do you know what is law of ossification? The center which appears first should fuse last with the shaft. Okay, but in fibula, the center for the lower end, it appears also first and it fuses also first, because the lower end of the fibula is an important component for maintaining the stability of the ankle joint, which is responsible for walking. Okay, so that's why it fuses first, because of the functional need. Okay,